Welcome to our in-depth exploration of a topic that's often overlooked but holds crucial insights into your well-being. While it may seem like an uncomfortable subject to discuss, paying attention to the colour of your stool can provide vital clues about your digestive health and overall condition. In this video, we shall delve into the various shades of stool, from the normal to the alarming, and explain what each colour can indicate about your body's health. Whether it's something as simple as dietary changes or as serious as a medical condition, understanding these signs can help you take proactive steps towards better health. So, let's get started. Now, brown poop colour is generally a sign of good health and is considered normal. The brown colour comes from a pigment called stercobilin, which is produced during the digestion process. Stercobilin is derived from the breakdown of hemoglobin in red blood cells, which is processed by the liver and then excreted in bile. As bile travels through the intestines, it interacts with bacteria and other digestive components, eventually giving stool its characteristic brown hue. A consistent brown colour indicates that your digestive system is functioning properly, with bile being adequately produced and effectively processed. Diet also plays a role, as foods rich in fibre and a variety of nutrients support healthy digestion. While slight variations in shade can occur due to different foods or minor changes in bile production, consistently brown stool is generally a positive sign. If there are sudden or dramatic changes in stool colour, such as to black, red or pale shades, it may indicate a need for medical attention. However, the regular appearance of brown stool is a reassuring indicator of a healthy digestive system. Green colour. Green stool can be surprising, but it often has harmless causes and is usually not a cause for concern. The most common reason for green stool is the consumption of green-coloured foods or drinks, such as leafy vegetables like spinach, green food colouring, or iron supplements. These foods and additives can impart a green hue to your stool as they pass through the digestive system. Another common cause is the rapid passage of stool through the intestines. When stool moves too quickly through the gastrointestinal tract, bile, which starts out green, doesn't have time to break down and change colour. Bile is a digestive fluid produced by the liver and stored in the gallbladder, and it helps to digest fats. Normally, bile changes from green to brown as it travels through the intestines. Rapid transit can occur due to diarrhea, which may be caused by infections, medications, or gastrointestinal disorders like irritable bowel syndrome, IBS. Less commonly, green stool can be a sign of underlying health conditions such as Crohn's disease, celiac disease, or food poisoning. If green stool persists or is accompanied by other symptoms like abdominal pain, diarrhea, or weight loss, it's advisable to seek medical advice to rule out more serious conditions. Overall, occasional green stool is typically harmless and often linked to dietary choices or minor digestive fluctuations. However, persistent changes should be monitored and evaluated by a healthcare professional if necessary. Yellow colour. Yellow stool can be a sign of various underlying conditions, ranging from dietary causes to more serious health issues. One common reason for yellow stool is the consumption of foods high in yellow pigments, such as carrots, sweet potatoes, or foods containing artificial yellow colouring. Additionally, excess fat in the diet can result in yellowish stools due to incomplete fat absorption. However, yellow stool can also indicate issues with the digestive system. One significant cause is malabsorption, where the intestines fail to properly absorb nutrients from food. Conditions such as celiac disease, where the ingestion of gluten leads to damage in the small intestine, can result in yellow, greasy, and foul-smelling stool due to the impaired absorption of fats. Another potential cause is problems with bile production or flow. Bile, produced by the liver and stored in the gallbladder, is crucial for the digestion and absorption of fats. If bile flow is obstructed, as in cases of gallstones or liver disease, stool can appear yellow because the bile, which normally helps turn stool brown, is insufficient. Additionally, pancreatic issues such as chronic pancreatitis or pancreatic cancer can also lead to yellow stool. The pancreas produces enzymes necessary for the digestion of fats, and when it's not functioning properly, fat digestion is impaired, leading to yellowish greasy stools. If yellow stool persists, especially if accompanied by other symptoms like weight loss, abdominal pain, or diarrhea, it's important to seek medical attention to determine the underlying cause and receive appropriate treatment. Clay color. Clay-colored stool, often described as white or pale-colored, can be an indication of issues with the biliary system, which includes the liver, gallbladder, and bile ducts. Bile, a digestive fluid, gives stool its typical brown color. When there is a lack of bile or a blockage in its flow, stool can become clay-colored. One common cause of clay-colored stool is a bile duct obstruction. This can occur due to gallstones, tumors, or strictures, which is the narrowing of the ducts. These obstructions prevent bile from reaching the intestines, leading to its clay stool. Another cause could be liver diseases such as hepatitis, cirrhosis, or liver infection. These conditions can impair bile production or flow, resulting in clay-colored stool. In some cases, medications that affect bile production or flow, such as certain antibiotics or bismuth-containing drugs, can cause clay-colored stool. If you notice clay-colored stool, especially if accompanied by other symptoms such as jaundice, yellowing of the skin and eyes, dark urine, abdominal pain, or unexplained weight loss, it's essential to seek medical attention. These symptoms can indicate serious underlying conditions that require prompt diagnosis and treatment. Black color. Black stool can be alarming and often indicates the presence of bleeding in the upper gastrointestinal tract, which includes the esophagus, stomach, and the beginning of the small intestine. This condition is known as melena. The dark color is due to the oxidation of iron in the blood as it passes through the digestive tract, giving the stool a tarry appearance and a distinct foul odor. Common causes of melena include peptic ulcers, gastritis, esophageal varices, or malignancies in the upper gastrointestinal tract. Non-steroidal anti-inflammatory drugs, NSAIDs, and certain other medications can also lead to gastrointestinal bleeding, resulting in black stools. However, not all black stools are due to bleeding. Consuming certain foods, supplements, or medications can also cause black stools. Foods like black licorice, blueberries, and dark chocolate, as well as iron supplements or medications containing bismuth, can turn the stool black. It's crucial to differentiate between these harmless causes and more serious conditions. If you experience black stool along with symptoms like dizziness, weakness, abdominal pain, or vomiting blood, it's essential to seek immediate medical attention. Persistent black stool, especially if not linked to diet or supplements, should always be evaluated by a healthcare professional to rule out serious underlying conditions. Red color. Red stool color can be concerning and often indicates bleeding within the lower gastrointestinal tract, which includes the colon, rectum, and anus. This condition, known as hemodichesia, typically results from conditions such as hemorrhoids, anal fissures, diverticular disease, or colorectal polyps and cancer. Hemorrhoids and anal fissures are common causes where swollen blood vessels or small tears near the anus can bleed during bowel movements. Diverticular disease involves small pouches in the colon wall that can sometimes bleed. More serious causes include colorectal cancer or inflammatory bowel diseases like Crohn's disease and ulcerative colitis, which causes inflammation and bleeding in the intestines. However, not all red stools are due to bleeding. Dietary factors can also cause red stool. Consuming foods with natural or artificial red coloring, such as beets, tomatoes, red gelatin, or certain red-colored snacks, can lead to a reddish tint in stool. Medications containing red dyes or certain antibiotics can also produce red stools. If you notice red stool, especially if it's persistent or accompanied by other symptoms like abdominal pain, dizziness, weakness, or changes in bowel habits, it's crucial to seek medical attention. These symptoms could indicate significant GI issues that require prompt evaluation and treatment. We hope this information has been insightful and has helped you become more attuned to the subtle signals your body sends. Remember, while changes in stool color can often be harmless and diet-related, they can also be important indicators of underlying health issues. Paying attention to these signs and seeking medical advice when needed can be crucial for maintaining your well-being. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this information. And don't forget to subscribe to our channel for more health-related content and hit the notification bell so you never miss an update.